The CDC is warning of an overall high level of respiratory illnesses in the U.S., and this is fueling concerns of what is called a quad-demic. It's an outbreak of COVID, the flu, RSV, and norovirus all at the same time. Yikes. Dr. Diane Hess joins us now in Studio 57 to help us understand what this all means. Thanks for being with us and joining us. I can't tell you how many people I know who are either on vacation and got the norovirus or have RSV, and there's so much of this bouncing around. Let's just quickly look at the CDC data to show some unusual trends. ER visits for RSV and COVID are trending downward. We hope to show this to you, but just imagine a line going down. And then visits for the flu are going up. Why is that?
It's just seasonal. So, RSV was peaking a little bit earlier, and now it's going down. Same with COVID, and it's flu season, and it's very contagious. And the flu vaccine rates this year have only been about 43%. So people are getting the flu, and even, I definitely have patients who've gotten the flu with the flu vaccine, but they're sick for 2 or 3 days. They're not ending up in the hospital. Okay. It's really important to get the vaccine.
Well, talk to me more about that, because some may think it's too late in the season to get vaccinated. You're saying not so?
Definitely not too late. You should get it. If you have not gotten it, you should get your flu vaccine.
Another random thing bouncing about is the bird flu. It's affected millions of birds. The CDC says the risk to the public is low right now.
Yeah, out of all the things we have to worry about, bird flu is probably the lowest on my list. It's not very dangerous, and it's treatable. So that's not my big thing. For elderly people, the RSV vaccine, I don't feel like it's been promoted enough. Okay. Babies can get RSV vaccine now up until 8 months. Yeah. And pregnant women.
And what about, COVID is not at the forefront of our thinking all these years later. Might there be a level of undiagnosed COVID bouncing around?
Yes, and the truth is, I don't really test so much for COVID anymore unless somebody's extremely sick, because it's really just a cold now.
Which we were told during the pandemic that this was endemic and we would have to deal with COVID as we deal with other things.
Exactly.
So then, considering all of that, what should we all be doing as we go about our business, and maybe we feel the sniffles and the weather is getting, is cold? What's the best advice for people?
If you're sick, stay home from work. Good hand washing. Norovirus is completely spread from, fecal oral. So good hand washing after you go to the bathroom, wiping down surfaces, wiping your kids after they come off the subway, the bus, the train, washing their hands. Just good personal hygiene is really important, and staying home if you're sick.
This is really useful advice. So as people see all these headlines about the flu and all these other things bouncing around, you're saying don't freak out, but
take care of yourself and be a good neighbor. You don't want to get sick when you go to work because your coworker is sick. Yeah. I think for a lot of families, the babysitting and issues like that is like, oh my God, they've been sick the whole winter. I can't take off another day of work.
Great advice. Dr. Diane Hess, thanks so much for joining us in studio today.
Thank you.
Come back anytime.